Hey, hi. Oh boy, here we go. We are going to talk about perimenopause. I'm really thrilled that this is becoming more of a part of our discussion, but I also know that there's like a lot of debate, a lot of confusion, a lot of distrust on the internet, and a lot of miscommunication between patients, doctors, physical therapists, etc. I even posted a question box on my stories asking what you guys wanted to know before this video, and honestly, the most common feedback I got was that you don't even know what to ask. You just need to know what the basics are so that you can start to learn and understand what to ask when you go into your doctor's office. So for this video, I'm thinking that we frame it as more of like an educational piece, and then this can be a series that we continue to dive into because it is fairly complex. It's continuously changing, and there's always new research to talk about. So I think that's how we're going to do this. Before we dive into this, I think it's important to understand that perimenopause is not just like when your period starts going rogue, and it's not just about hot flashes. It's a little bit more complex than that. Is one of the biggest shifts that we will undergo as women in terms of musculoskeletal health and in terms of performance, and we're still wildly uneducated about it. If you've hit your mid 30s to early 40s and you started to think, what the heck is going on with my body? The good news is it's not just aging, but it's also not only hormones either. I've kind of separated this in terms of my thought process because if you've listened to me talk before, you know that I can absolutely yap about this. So I've tried to make it a little more organized for you. Let's start by just talking about what perimenopause actually even is. Perimenopause is the transition leading up to menopause. It can start in your late 30s, early 40s, and then it lasts for 10 years. There's a range, so it can last a little bit different for everyone, but 10 years is kind of a general guideline. During perimenopause, here's the issue. It's not like a smooth decline in hormones where we go from way up here to like slowly down here. In perimenopause, the hormone changes are fairly chaotic. So they're not just dropping, they're fluctuating and they're going up and down in really unpredictable ways, which is why you feel kind of crazy sometimes. One week you feel really great, the next week your sleep is off, your workouts are off, your mood is off, all the things happening at one time. And a big disconnect that I hear about a lot is your labs can look normal, your blood work can look normal, all those things can look normal, but you're like, no, I still feel off. Estrogen gets a lot of attention, but it's not the whole picture here. So I'm going to go into detail on what happens to the big ones, which is progesterone, estrogen, and testosterone. Early in perimenopause, when we start having these symptoms, what happens is progesterone starts to slowly drop because we are experiencing ovulation less consistently. That's one of the first things that's actually going to happen hormonally. Estrogen, on the other hand, can kind of spike and dip and is a little bit more chaotic. Testosterone can actually start dropping in your late 20s. Later on in perimenopause, estrogen decline can start to be a little bit more steady, but early in that phase when it's very up and down is where people really start to struggle. So where my piece comes in as a physical therapist is that estrogen is a really big deal in terms of our muscle and tendon health. Estrogen and progesterone are not just reproductive hormones. They influence bone, tendon, nervous system, recovery, and all of those things make a really big difference in how you feel in the gym, after you're going home and kind of sitting down and thinking about your workout, how difficult that was, why did it feel that way. Estrogen and progesterone can have a role in that. There's a growing body of research talking about something called the musculoskeletal syndrome of menopause. And you can think about that diagnosis as like a cluster of changes. That can include joint pain, loss of muscle mass, reduced bone density, and decreased performance capacity, all under that one diagnosis. But hear me out, you don't really need a study to tell you that. You probably feel it. You're going to hear women tend to say, I feel more sore than I used to, or maybe I'm doing the same workouts, but I'm not seeing the same results. I'm eating the same things, but I'm not seeing the same results or maintenance. I promise you, I haven't changed anything. I hear things like my tendons feel cranky, or maybe I'm not recovering as quickly as I used to, so I need to adjust their load and training. And physiologically, that makes sense. Estrogen does play a role in collagen turnover, tendon health, inflammation, muscle function. And so when we start to see that decline, all of those things can be affected. And why you feel like your body can be breaking down during that time, it usually just means we need to shift or change the inputs. And before the internet freaks out about me saying that, I am not saying that we need to completely and totally overhaul how we're training. But there are things that we can do a little bit differently, understanding what our body is going through. I want to touch on a really big debate that's happening right now with some of the more recent research talking about, are these changes happening because of age or are these changes happening because of menopause? On one side, you're going to hear people saying, well, this is just part of aging, and as we get older, we see a decline in all of these things. The other camp is going to say, well, this is part of perimenopause, menopause, and if we could adjust hormones, it would make a really big difference, and then we wouldn't have to see these changes. The reality, like most things, lives kind of somewhere in the middle. But let me talk about why this matters and why the research has been kind of trending towards saying, oh, it's just aging. It's really because it's obviously very tough to separate aging from menopause. Cause and effect can get messy in research world because everything happens all at once. So you're getting older, hormones are fluctuating, sleep is changing, stress is different, the body composition shifts, and it's hard to tell, is that because of perimenopause or is it because I'm getting older? And yes, men can see some of these age related changes too, which makes us think, okay, part of it is aging. And I'm not saying guys have it easy, but I am saying I think it's pretty clear that women have a harder time with the aging process, not just because they feel differently about it, but because there's actual physiologic changes that men are not having to experience. So, in practical terms, I think that the research is just starting to catch up. I think women have been feeling this and experiencing this for a long time, and we have a long way to go in terms of the research. I'm not saying that there's no research because I think that that is an overused statement just to say we don't understand the female body. But I do think our methods and protocols and all of that good stuff will continue to develop with time, and that's going to make a really big difference in how we interpret this. So if you feel like something has shifted in your body, you're not just imagining it. You may read one research study that really agrees with you and really validates everything you're experiencing. And then you may read another research study that says, hey, this is all just a part of the aging process. Why are you being so dramatic, kind of thing? This is a good time to talk about the fact that research is incredibly important, and I am such a huge proponent for it. I want it to continue. I want to know all the things all the time, and I want to update as we learn and continue to grow. Research is not a substitute for clinical experience and anecdotal evidence. So if a client comes to me and says, I am eating all the same things, I'm doing all the same things, why am I not responding the way that I used to? My job is to believe them. And my job is to pull things from the research that I feel like are important and applicable for that person in front of me. It's not to say, hey, I hate to break it to you, but this just says it's the aging process. So here's a study, and I can't really help you with anything else. It's also not to say, hey, if we got you on hormone replacement therapy, everything would feel just dandy and you don't have anything to worry about. I know it's hard to believe these days, but there is a happy medium. So here's what you can actually do. Here's the actionable part, and I think that this is what tickles my brain the most. The answer is not just accept it, and the answer is not just hormone replacement. In general, from the musculoskeletal side, it's a very layered approach. We have to keep strength training. Okay, this is something that actually protects your longevity. It's going to make a huge difference in your quality of life. I call it my hay in the barn. Every time I work out, I am stacking a brick on the foundation of the house, knowing that with time, the aging process is going to slowly start to tear that down. But the more that I can build up going into that, the better off I'm going to be as I approach that aging process. 2, adjust recovery expectations. You have to know that when you do a hard effort, it may take you a little bit longer to recover. This is where I think things like polarized training can be incredibly important. Hard days hard, easy days easy, instead of tons of moderate or middle range work. I think our bodies tend to respond to that better when we're younger, but the older we get, the more important it is to hit peaks and valleys over the course of the week. Not every single workout peaks and valleys, but if I look at my week and I look at my month, I have workouts that were clearly hard and I have workouts that were clearly easy versus everything being somewhere in the middle. 3, we need to respect sleep like it's part of the training plan. Sleep is where so many good things happen. And the challenging thing with perimenopause is that sleep can be hard to come by. It can feel a little bit more restless. You can have a harder time falling asleep. We may be waking up in the middle of the night feeling we can't get back to sleep. We may be experiencing hot flashes at night. So we have to sleep to make sure that hormones are as stable as they can be, that we're decreasing all of that inflammation, we're recovering from all the things that our body did during the day. I think about it like recharging my batteries. If I only plug my phone in for 10 minutes, I'm not going to get a whole lot out of that. If I can get a solid 8 hours of sleep, and I know that's so hard, but if I can really work on my sleep routine and sleep hygiene, that's going to make a really big difference in how I feel. That becomes even more important when our body is going through this chaos. Number 4, I see a lot of people get this wrong. We have to fuel appropriately. I actually think that when I see clients who underfuel and try to really cut back on calories and cut things down and really train hard in the process, their bodies don't respond the same way that, again, I would think about in my early 20s. I've seen this in my own training. If I, skip lunch and end up going on a run, 1, the run feels freaking terrible. And 2, I feel like I hold more central abdominal fat when I do that versus if I eat a steady lunch, I have a regular kind of like steady blood sugar response and I have fuel to work out with on my workouts so that I can work harder during those workouts. So it seems counterintuitive, but being really steady about fueling is incredibly important. And I think our bodies can tolerate that better as we get older. Before the calories in, calories out crowd comes for me, I do think that timing matters. That's a whole different topic for a different day. And again, it's one of the things where, yes, I understand that the research says X, but I'm not necessarily sure that that's translated to a lot of the people in front of me. And again, I love the research. Please don't be mad. I just think there's a gap and we're trying to figure out where the gap is and we have to tweak that a little bit. Number 5, we can't be too proud to get support. So I hear this a lot. People are scared that hormones are like not natural, but you have to understand that outliving our ovaries is also not natural. If we didn't have modern medicine, I would have died from appendicitis in college. So Again, perimenopause is where that ovulation process becomes a little less steady, less regulated. And so what's happening is our ovaries are doing less and less of their job because we're getting older and older and outside of those childbearing years. And when the average lifespan was like 50 years old, that wasn't that big of a deal. But now we live a long time, and that's really good. And we have all of these options to help us so that we're not just suffer wars for the rest of our lives. This could mean hormone therapy. If your doctor is not willing to have that discussion, I'm going to tell you right now, you need to find a new doctor. We have come so far on hormone replacement therapy. The studies that we talked about in the 90s, early 2000s were really bunk and wrong and scared the crap out of a lot of people. And I'm ready for those to just like absolutely burn in a fire. You have so many options. There are so many options, whether you want to change how you apply it, when you apply it, how much you use. The hormones we use now are more bioidentical, meaning they're exactly what your body already creates. And you're not trying to supersede your normal levels. You're just trying to get your body to the levels that you had before so that you feel good and don't have to deal with the symptoms associated with this. It's not going to change your ovulation. It's not going to change the fact that we are moving out of those childbearing years. It's not going to change your track in terms of like, hey, we're going to delay menopause. It is just going to make life more livable and enjoyable while we approach that time. There are non-hormonal options. Working with someone like a dietitian who has a really good background in terms of understanding how certain foods and things can trigger and change hormones can be really important if you're someone who wants to take that route. Personally, I think pelvic health work is great because, again, estrogen and progesterone affect our tendons, muscles, they affect our tissue resiliency. And so you can feel a lot of heaviness, pressure down at the pelvis. You can have pain with sex, a lot of dryness associated with those hormone changes, and we can help with that. And being on top of pain and addressing it early. So there's some really interesting study talking about things like tendon health and, again, things like frozen shoulder, where we've kind of wondered where the heck is this coming from, and it being more of an estrogen problem. Really fascinating stuff out there that's happening. We've been trying to treat this for so long. We really haven't known from a PT standpoint how we can speed up the process. And now we understand it might be a little bit more complex than just my shoulder gets stuck. So when you start to notice pain, especially if you feel like it's tendon pain, that's where musculoskeletal PTs come in. That's our job. We're really good at that. Training using isometrics can be incredibly important for tendon health and resiliency. So yes, the movements you're already doing are probably fine, but there's things that we can do to help the tendons more so than the muscles so that you go into perimenopause and postmenopause with a really good, strong, healthy body. So at the end of all of this, the whole point is that there's not a one size fits all approach. It's going to depend on the things that you personally want to try, that you personally want to pursue, that you personally feel like you'll actually be sustainable with, right? If you're not going to stick with it, if you don't really like going to physical therapy, then guess what? You're probably not going to do a regimented PT program, or maybe find a new PT. But I think for so long we've seen perimenopause as like the beginning of this like decline into menopause and postmenopause. It's not a decline, it's a transition time. And again, it's not something we just have to suffer through. And the more you can understand what's actually happening, I think you can really shift that mindset from, hey, my body is failing me, to, hey, my body needs something a little bit different, or I need to start seeking out some of these pieces of the puzzle, or I need to start drafting a healthcare team of individuals who I know and trust to make sure that I can get through this phase in the best possible way with the highest quality of life. So if you're in this phase and things feel different, you are not crazy and you are not alone. We just don't know everything yet, but we are getting better at it.